Good evening, everybody. My name is Jane Ransom, and I'm the Executive Director of the American Brain Foundation. I want to welcome you and thank you for joining us. Tonight, we're going to be learning about building equity in global brain health. And our foundation is committed to sharing valuable resources, increasing public awareness of brain disease, and showing how research is the key to treating and defeating these diseases. Our webinar events, like this one tonight, are opportunities to connect with you and connect you with researchers and experts in various topics of interest around brain disease. The American Brain Foundation funds research across the entire spectrum of brain diseases because we know these diseases are interconnected, and that curing one brain disease is going to mean being able to cure many. And we know that tens of millions of Americans suffer from brain diseases and disorders, and that's why the American Brain Foundation has invested more than $40 million in research grants to almost 300 researchers. So that is my intro, and I want to now move us into our topic of conversation, equity in global brain health. Of the 50 million people affected by dementia worldwide, the highest toll is experienced by at-risk and disadvantaged populations. And our speaker tonight, Dr. Bruce Miller, is here to talk with us about addressing issues of brain health and dementia in disadvantaged populations. Dr. Miller is the A.W. and Mary Margaret Clausen Distinguished Professor of Neurology at the University of California, San Francisco, and he directs the UCSF Memory and Aging Center and is the founding director of the Global Brain Health Institute at UCSF, which is a collaboration with Trinity College Dublin. Dr. Miller is a behavioral neurologist who studies the underlying mechanisms of neurocognitive disorders and is a world-renowned expert in the diagnosis and management of dementia. Dr. Miller's been featured in Fortune magazine, the New York Times, 60 Minutes, and the PBS NewsHour, just to name a few. He's authored more than 1,000 publications. He's received many awards, including the Potamkin Prize for research in Alzheimer's and related dementia from the American Academy of Neurology, and that's a prize that's funded by the American Brain Foundation. Miller's extensive knowledge in clinical diagnosis, disease pathology, and brain behavior relationships make him a widely sought after teacher and mentor. So I'm going to turn the baton over to Dr. Miller, but before I do, I want to remind you or let you know, if you haven't been to one of these events, that you're welcome to put questions in the chat during the talk that we're going to hear. And then we always have a robust question and answer period afterwards, and we'll try to get to all your questions. So with that, thank you so much for joining us, Dr. Miller. We really appreciate your time. I'm going to turn it over to you.
Thank you, Jane. Thank you, Lee. I'm really honored to be with you all this evening. It's rainy. It's been unbelievable rainy in California. I hear in Minnesota you're experiencing some snow, but I'm just beginning to dry out. So I'm really excited to be with you tonight. Let's see. I'm going to want to share. Stop share. Let's see. Okay. Let me try that again. Oh, here it is. Great. Okay. Well, I'm gonna talk about the Global Brain Health Institute, which I helped to found. It's an interesting story. It's a silent story. It was started by a silent philanthropist, a man named Chuck Feeney, who gave over the $8 billion away, but didn't want it advertised, didn't want the Global Brain Health Institute named after him. He felt giving should be done just to give. So around 2014, one of my dear friends, Ian Robertson from Trinity College in Dublin, I began thinking about what a Global Brain Health Institute might look like. Why Trinity? Why San Francisco? Well, that's the donor. Chuck is an Irish American, very proud of his Irish roots, and has invested heavily in Ireland around a number of products, including brain health. And he lives in San Francisco, and he believes in UCSF. So that's why it's formed between the two institutes. We really formally started in 2016, taking our first class. And while you'll hear we do things other than training fellows, this is really focused on training fellows. Chuck's first $7 billion were invested in infrastructure around health. So hospitals in poor countries, low and middle income countries, MRI scanners, et cetera. But the last billion, and I'll talk to you about the programs other than ours at the end, are focused on training fellows who will change health. So the concept between GBHI was focused on aging initially, although we're changing a little bit. And the dementia costs are staggering, and will be even more so if we don't start to get really much better interventions. And the idea is in low-income countries that the costs will increase by 239%. They'll increase in high-income countries as well, but the magnitude of the problem in poor countries who are least able to do something about this financially is really an epidemic proportion. And in places like Africa, where predominantly infectious diseases have been the major public health interests, increasingly in almost every country, there's a realization that their populations are getting older, and that chronic diseases such as Alzheimer's are increasingly more important. So one of the really interesting things that happened around the time that we formed the Global Brain Health Institute was that a number of research studies, Jill Livingston in England, Christine Yaffe, Deb Barnes at UCSF, began to show that modifiable risk factors account for up to 40% of worldwide dementia in high-income countries. So that's really staggering. This is the idea that lifestyle, societal changes could dramatically decrease the prevalence of dementia, particularly Alzheimer's disease. So I think increasingly, we think that a lot of these risks may begin very early in life, even in utero. I've been struck by beautiful work done out of USC by Tuck Finch, that pollution, at least in animal models, increase the likelihood that these mice will develop cognitive impairment. And I think this same group has shown that if you live close to the 110 freeway in Los Angeles, you have a higher prevalence of dementia than people that live 5 miles away from it. So beginning in utero, early life, I'll come back to education. It's a big risk factor for dementia. Environmental toxins. When I was at UCLA, I worked on a twin study where we'd looked at a cohort of male veterans who were in their 70s. And the punchline was that these people's cardiovascular risk factors documented at age 50 directly related, inversely so, to brain volume at age 70. So midlife hypertension, late life cognitive impairment. Other things, show a surprisingly powerfully potent risk for cognitive impairment. Mood disorders, social isolation, diabetes, of course, smoking. These are things that happen along the course of a lifetime. And so if you could intervene, for example, around education early in life, it would have positive outcome across the lifetime of that person. We believe that social determinants of health are ultimately the determinants of how well our brain ages. And so it's really an equity issue. If you're not given the chance to develop your brain in the way that almost certainly all of us here on this call today do, you are going to suffer consequences across your lifespan. So we designed a fellowship. We hope to be a leader in the global community dedicated to protecting the world's aging populations from threats to brain health. This was our first class. So the idea is we will train fellows. They will mostly come from low and middle income countries or communities in the United States and Ireland. They will try to reduce the scale and impact of dementia worldwide. Changes in lifestyle will be important, and many of the fellows are thinking about changing lifestyle in their own countries. We have a really distinguished board, a number of people. I'll just point out Maria Carrillo from the Alzheimer's Association, because Maria and the Alzheimer's Association has partnered with us in a very interesting way. So the fellows were just undergoing selection. Huge number of people apply for this program. It's one of the most selective programs I've ever been involved with. They join our program for 12 months. About half the class is at UCSF, the other half is at Trinity. On Tuesdays, they share via Zoom a core curriculum of a series of pods that are focused on economics, epidemiology, law and ethics. Had a beautiful session today about end of life. We train a lot about neurodegenerative diseases, neurology, but we think that a broad education for these fellows is really going to be important, because they're going to have to talk to their health ministers in their countries and convince them that brain health is important for the country. It may even be cost effective. So I think having literacy in a wide range of topics is really important. We have a leadership program that I'm very proud of, and it comes very close to my own research. So we say that in addition to the left hemisphere sorts of things that our fellows will learn about prevalence of dementia, different degenerative diseases, the molecules associated with them, they're also developing their right hemisphere. And we have a program that's focused on values. We have the acronym of FORCE: authenticity, fairness, openness, respect, courage, and empathy. My research into frontotemporal dementia has taught me that many of the things that we really value in other human beings are compromised in frontotemporal dementia with the degeneration of the right frontal and anterior temporal lobe. So for example, there is a circuitry of empathy, and we can study it, we can understand it, and I believe in trainees, we can build it. And I think these are the kind of trainees that we really want focusing on the brain. We also say that these fellows are Atlantic Fellows for life. They are mentored, giving clinical experience with us, but they also get career duration mentoring. We have a pilot program for our fellows, and we constantly keep in contact with our alumni, seeing ways that we can empower them in their own countries. So when we first started, we at UCSF focused a lot on Central and South America. They're adjacent to us. We had good connections there. Trinity focused a lot on the Middle East, North Africa, and Southern Europe. We are starting to shift our focus, and we haven't stopped in Latin America, but we are increasingly excited about the type of fellows that are coming to us, in particular from Africa and now India as well. Another really unique aspect of this program, and these fellows are all learning together. So we have to be very broad and eclectic in the way that we teach. So there's certainly a lot of physicians, epidemiologists, biomedical cognitive science people, but we're also training artists, people from the humanities, people from social science, education advocacy, and business technology, because we believe that this is really going to take a huge number of different disciplines to solve cognitive impairment. Sometimes the artists are most fluent at telling our story to the public. And so our fellows work in hand with artists. I'd love to talk with you more about that possibly during the question period. So this is one of the big coups that we've had. We work with the Alzheimer's Association and the Alzheimer's Society of UK, and now an Alzheimer's Society in France, to support pilot projects for fellows. And each one of them is eligible for a pilot project that they bring back to their own country. I'll mention a few of them. And many of these small scale pilot projects lead to bigger scale projects. So this is one of the ways that we support our fellows when they return. This is a big program, and it seems to be getting better and bigger. And so we started in 2017 with almost $500,000 for 17 awards. Last year, we had $650,000 for 26 awards across 18 different countries. We're really thrilled by the sort of projects that our fellows are doing, and I think they're really beginning to change brain health in the countries that they come from. So although the number of fellows is still small, they are really mighty and incredibly focused. A few examples. Eleanor Bayan is a rehab physician from France, I would say also a health economist, brilliant. And she made a movie called Bobby's Brain. There you can see Bobby's Brain right there. And she decided that education of children across France about what happens to the brain if you don't take care of it was really important. It's a beautiful movie, about 7 minutes. My grandchildren loved it. It's been piloted in 15 classrooms initially with 450 children aged 7 to 11. But we care about numbers. We care about how many people are watching these products on Zoom, on YouTube. And this fairly early had gotten 70,000 views, had been translated into 4 languages, and also got engagement from the French education minister to support this effort across all the schools of France. This is a very powerful study. Elisa Rezende comes from one of the poorest regions of Brazil. 35% of the people in Elisa's elderly cohort over the age of 60 were illiterate. What Elisa did was she brought MRI images up to San Francisco, 2016, from a healthy elderly group of people. She had epidemiologic data, risk factors, et cetera, on this population, and did the simple measure of how big is your hippocampus? How big is this tiny little region in the brain where Alzheimer's disease starts, and which helps us to remember from moment to moment. What Alyssa found was if you were illiterate or had less than 4 years of education, you had a small hippocampus compared to people who had learned how to read. So I think this was an extraordinary finding. It's not totally unique to Brazil, and I think we've had similar sorts of experience with other countries across the world. So think of the inequity of this. You come from a poor family, you don't learn how to read, you don't develop the connections in your memory system that might help you navigate life. then on top of it, this increases the likelihood that you get cognitive impairment later in life. So after getting this pilot study, Alyssa got a Fogarty grant from the NIH to expand the work. She went to the Brazilian government and said, let's teach people over the age of 60 who don't know how to read. So the program's ongoing. We have a good surrogate measure of its efficacy. Is the hippocampus in that population going to grow? My bet is that it will. Think of the implications for that society. Another project from Agustin Ibanez from Argentina started with a pilot. Now a big NIH-funded R01. It involves San Francisco, Mexico, Colombia, Peru, Ecuador, Brazil, Argentina, Chile. It's just an amazing effort to study 6,000 people with Alzheimer's disease or frontotemporal dementia across Central and South America, thinking about the genetics, the social determinants of health. We've gotten whole genome on our first 1,000 people. A third of those people are Indo-American. So I think these are going to be the first study in North America of significance that thinks about genetic risk factors for the Indo-American people that crossed the Bering Strait about 18,000 years ago, who are in our country and across South America as well, very underprivileged. This program has changed us at UCSF. So it has made us focus more on our diversity in San Francisco. The fellows work in our different clinics across the city of San Francisco. Boonlead T leads a major effort on Asian Americans. Sergio Lanata leads exploration of our Spanish-speaking populations in the Mission District of San Francisco. And Charles Winden is beginning to think about our African-American community. The fellows are thrilled to be part of these outreach efforts. With our artists, we've begun to think about programs that enrich the city, that involve UCSF and GBHI. And so we have formed a formal relationship with the Conservatory of Music to put on events that focus not only on music, but also on creativity, the role of music in enhancing brain function, and a variety of neurologic topics. We've done a great event on the science of creativity, brain resilience, talked a lot about things that make our brains stronger, talked about neurodiversity. In this session, we focused on children with learning disability related to reading, thought about, what that means for the brain and, how much we can reverse that problem. Our last event was about sleep and dreams and brain health. We have more than 500 people that have joined in for all of these events. Finally, this is my last slide, is we weren't the only program that was funded. We are the Global Brain Health Institute for Equity and Brain Health. Our fellows are Atlantic Fellows for Equity and Brain Health. There's a program focused at racial equality in South Africa. Columbia University trains fellows every year. There's one located at the London School of Economics where fellows are thinking about economic inequity. There's a social equity program of Indigenous peoples in Melbourne, Australia, that also has a New Zealand branch. There's a health equity program in South Africa, another one in Southeast Asia. George Washington has a slightly smaller program. And one of the really interesting things is for 30 years, the Atlantic Institute, based at the Rhodes Trust, is opening its arms to our fellows from all of these different programs, having joint education programs. They will offer funding to fellows from across these equity efforts, thinking about how we can change the world with healthier, brains in a more equitable world. So thank you for hearing about one of my favorite things. I should also mention one more thing, and we're not doing these things alone, but look at all of the extra support we got for this Latin American program. We have gotten support from the Tau Consortium, from the Alzheimer's Association. So, we are getting organizations to accompany us as we find the best programs across the world. So thank you for hearing me. And I think that's all I had to say. Maybe I was a little long-worded.
Thank you. That was wonderful. I'm going to ask people to throw out any questions, either just directly, you can speak up directly, or you can put something into the chat if you like. And maybe I'll start things off. Hearing about all these amazing projects around the world, I see that we have a lot to learn in the United States. And I'm wondering if any of these projects the learnings are being migrated into the United States by any scientists or practitioners.
Yeah, I mean, I think a lot of the projects we do together. The big NIH funded project in South America, we have a parallel effort at UCSF and are working with the people in Central and South America to look at images from populations with very different socioeconomic backgrounds. So that's one thing. We're training U.S. fellows. We've had some incredible U.S. fellows. One of the fellows that we've trained has Tanisha Hill-Jarrett, has focused on African-American women and is focusing on how their education, their relationship to society, the inequities that face African-American women influence their health outcomes. So yes, I think we have a number of fellows from the United States focusing on our U.S. problems related to inequity as well. Yeah.
Somebody here has said frontotemporal dementia was mentioned frequently. Are other types of dementia included in the studies?
Absolutely. I think each fellow, I mean, the South American study I talked about focuses on Alzheimer's disease, frontotemporal dementia. I think each fellow has his or her own project. We've had some fellows from Ireland who've really focused on the Parkinsonian dementias, dementia with Lewy bodies. So yeah, each fellow has a slightly different focus on, a lot of our African fellows are focused on vascular dementia. They believe that's really important cause for dementia in Africa. And there's been almost no work for many, many decades. In the 1980s, there were some comparisons between Ibadan, Nigeria, and Indianapolis, Indiana. And actually, at the time, Indianapolis, Indiana, African-American population had higher prevalence of dementia. That's changing. And I think our Nigerian fellows are showing that as they adapt to a US-style diet, less exercise, more urbanization, that they're starting to see, similar, very high rates actually of dementia. Yeah.
One person asks here, what were you going to further reference with in utero environment?
Yeah, I mean, I think this is something that is very hard to study because often we're going at this many, many decades later. But I think there have been a lot of pioneering efforts. One way you can think about this is model systems. And so you can, think about, there's a group at UC Davis, for example, that have been studying air pollution in mice. And they put this right over a highway in Berkeley. So they're getting pollution information in these mice that is fairly equivalent to exposure that we suffer, people who live right next to that freeway. So that's one way. The second way is just beginning to do work. It's been pioneered by Amy Kind at the University of Wisconsin. But Amy is looking at the zip codes that you lived in, that you were born in, and thinking about health outcomes with this as well. So this is another really, really interesting way of, getting at, the influence of environment many, many years after, that happened. But, I'm one of the real believers that, some of the best research that'll go on in the future is going to, involve studying us human beings across our lifespan. Because there's no doubt that there are, lots of risks that happen in childhood, and probably lots of interventions that we can make that will make a difference for the society as a whole, preventing cognitive impairment later in life, and improving the lives of children who do not get the enriched environments that someone with a high SES does at the moment.
Another question here is regarding decreased hippocampus volume relative to education. How was the study controlled to evaluate the alternative hypothesis that small hippocampus would lead to limited educational progress?
Yeah, it's an interesting question. I think these are people who come from a very similar, socioeconomic status and environment, et cetera. And so they're already in their 60s, 70s. But I mean, even if the alternative hypothesis, which I don't believe, I don't believe that it's a very smart thought, though. I mean, I just don't think it's going to pan out, but it should be controlled for. But it may not matter that much, because I think if we can, by stimulating the hippocampus with a reading paradigm, if we can change the volume, then it doesn't matter why it ended up smaller to begin with. So I think it's a hypothesis that in that way can fairly simply be answered. The question you asked, that's gonna I'm thinking about how to do the study. It's a bit almost impossible for me to think about unless you did studies across the age, But I think more and more the data on social determinants of health think about early deprivation, tons of data from animal models that this is critical. And, I think not having a big hippocampus at birth should not interfere with your ability to learn how to read. This is really, I think socially determinate. That's my view of this.
Thank you. There's someone here who's curious about whether you've conducted any research on adults on the autism spectrum.
Yeah. We are not in this, but I will say this, increasingly, because we believe so much that the environment of children and their brain health is critical for all, epochs of life, that we are thinking about beginning to work and take fellows interested in children. So we haven't had people interested yet in adults on the autism spectrum, but I think it's a nice idea. Yeah.
There's a person here, she's a mother of a 47-year-old man who has severe traumatic brain injury. And she was told that he would go into early onset dementia. And do you have any thoughts on this? And, is there, I'm going to add, is there any research on brain trauma going on in other countries and the relationship to dementia?
Well, without a doubt, brain trauma is a major cause for cognitive impairment in low socioeconomic populations. One of the things Chuck Feeney did without any fingerprint, this is probably the first time anyone mentioned this, but he went to Vietnam and looked at all the people on motorcycles and said, wow, this is terrible. So he helped with the government pass a law that everyone who rode on a motorcycle had to wear a helmet. And, imagine the impact of, doing that overnight. Let me give a slightly long-winded answer. I've done a little bit of consulting with the Army and the traumatic brain injury people there. And I think, the research to date on this is so tiny. We have so much farther to go. We do know that head trauma, probably twofold, but doesn't mean it's inevitable, but it increases the likelihood that someone will develop cognitive impairment later in life. We don't know yet how to rehabilitate the brain. And I think a lot of people after traumatic brain injury and a lot of people never get the opportunity to get into the kind of rehabilitation programs that might really make a difference. So I think for the American Brain Foundation, this is really important. And it's something that we got to do better as a country. But yes, some of our African fellows are interested in TBI as part of their cohort. So yes.
And just following from that, someone's asking, is there any research on progressive supranuclear palsy?
Well, yeah, I mean, yes. For example, our program in South America has a cohort of patients with frontotemporal dementia spectrum disorder. So all of those people include people with PSP. And the Tau Consortium, which is the world's leader in the research on progressive supranuclear palsy, is helping to fund that project. So, yes, and I think we're going to hopefully get, epidemiologic data on progressive supranuclear palsy. And yeah, I could go on and on, but I would not. I see Jane is getting me to move on. Yeah.
No, but I'll ask you another one. Here's another one. Do you believe there's a discordance between histopathological models for dementia involving chemicals such as amyloid are at odds with your findings that environmental influences and pre-existing disease such as diabetes increase rates of clinical dementia?
Yeah. So let me go at this question, I think, in the way that it's intended, but if not, tell me. So I think we don't exactly know how the environment, we don't have good markers for the environment yet. So we don't exactly know how environmental influence triggers pathology in the brain. So I think the question is a really good one. I can say from the work out of USC by Tuck Finch that actually that the major insult with air pollution is the white matter. So it's a very different way of causing cognitive impairment than our classic Alzheimer's disease model. But, I think the question, I think gets at a little bit about our impetency in understanding the environment. And it's really a lack of brain. The problem is if you get an environmental insult in utero, will the evidence for that ever, leave, or will it cause an insult? And then, the insult itself goes away and all you're left with is a pathology, which could be very general, like amyloid. So I think over time, we will get much better measures through epigenetics hopefully through environmental science of things like lead poisoning in children, what that means to the brain later in life. But right now, I think there's a huge discordance in our knowledge. Let me put it that way. That's a great question, by the way.
Okay, here's a comment, but I'm sure it is meant for your comment. It would be interesting to study different populations of children to see if there's a difference between the development of those kids who are exposed to intensive daily digital screen input versus those who do not have access to this. Of course, it would be a challenge to establish analogous baseline controls.
Yeah, I mean, this is on everybody's mind, including our governor, our governor's wife, Jennifer Siebel, who's put some money into this for study across the state. And, you know, I think we all worry. I have two grandchildren. They, at least my older one, is certainly interested in spending time with a digital screen. Is it bad for the brain? Is it good for the brain? I don't think we know yet. But I think we're going to see studies about this, Stephen. I think it's so important to society that we have to think about the good and the bad potential of video games for children and time in front of a screen. I much prefer working with my grandson hitting baseballs than I do watching him play a baseball game on the screen. So, yeah.
Have there been any longitudinal or generational studies of epigenetic changes?
No, you're as impatient as I am to the questioner. I think the epigenetic studies are just beginning, you know, and I think it is a totally uncharted territory yet. One thing we can do really well with epigenetics is get a pretty good shot at biological age. And that may be something that, you know, an environmental insult may accelerate. So I think it's going to have profound influence on our understanding of brain health, but we're just starting, sadly.
Okay, here's the one. People with dementia are predisposed to experiencing seizures. 10 to 20% of this population experience these. How may we be sure that smaller hippocampal volumes and ongoing cognitive decline are not due to subclinical seizures?
Yeah, we study that a lot at our site. Keith Fossel, who was a fellow with us, studies at Leonard Mukey, and I are very interested in it. We have not been able to show much of a difference in our cohorts who have Alzheimer's disease with seizures versus those without. But I think it's a great question and it's a great hypothesis. You know, I don't think our studies on that are yet definitive. But I think the one thing that's different about Elisa's cohort is we don't think they're having seizures because they're pretty young, you know, 45 to 60, and they are not cognitively impaired. So, you know, I think that may not be a factor in understanding the small hippocampi in that group.
Do you have any reflections worldwide on what it's going to take to connect the dots for policymakers with respect to, you know, brain health and its impact on everything else, and why it should be, you know, brought to the fore as the main thing?
Yeah, I'd love your thoughts too. Well, I think one thing, and we're hoping that some of our fellows are going to become health ministers and lead countries. Mm-hmm. My friend Facundo Manas from Argentina is decided, a neurologist, a brilliant scientist, decided that he needed to enter government. So he is the representative from a district in Buenos Aires. He will be running for the presidency of Argentina probably in 2023. He's got huge ideas about reading, early development, brain health for society, lost potential with every brain that is diminished. So you have those kind of leaders, you know. I really believe this is infectious in a good way, because once you see a leader like that, you'll never want to go back to ignoring these sorts of things. And I think the outcomes will be tremendous. So I think that's one way. That's one of the reasons we have health economists involved with our program. They've got to give proof to people, better than a lot of the things I said today, but really powerful economic studies that show a society benefits from good brain health. This is really important. And artists, I think artists tell our stories brilliantly. I think, you know, having the right artist, for example, Tom Hanks talking about HIV with a movie, Philadelphia, had a huge impact on AIDS policy in that country. So I think these are some of the ways that we're focused on this. But we were not, Ian and I, when we first put together this program, allowed to skirt that question. We were really asked to talk about long-term outcomes in societies. And so we are thinking about this constantly.
And speaking of artists and art, is there research on how the arts affect the brain? Like, if you, for example, if you have dementia, a lot of us who have relatives with dementia, we know that they really perk up, you know, with music, especially music they've known in the past, or they can get involved in art in a pretty meaningful way. Is there research about that? The research, I would say, is weak still. It's one of the goals of the Global Brain Health Institute. We're interested in two different kinds of art scholars. One are just great artists who can, you know, tell a story to society about the brain through their art. That's one group. The other group who can study the impact of intervention like music. I was on a number of committees that Francis Collins set up when he headed the National Institute of Health. He believed that music could have a positive impact on the brain. And so there are a number of research proposals now that are coming out of the NIH that are allowing people to ask questions that will tell us what kind of music intervention. And I think this is really complicated because it's probably, you know, is it changing mood? Is it slowing progression? At what stage of life is it important? We know that if you're a violinist and you're 10 years of age, white matter underneath your motor strip is bigger than kids who never picked up a violin. So we know this can affect brain structure at an early age. So to me, there are a huge number of possibilities about music, art. I have sort of a funny bias about this that, you know, it's not going to be one size fit all. And that I think we have to figure out, not only does music or art help, but what type of music, what type of population, what are our targets with this? But my heart of heart, I believe, yes, that this will be helpful in a number of ways. I noticed on your website a lot of care or attention paid to caregivers as well. Is that an international, can you compare apples and oranges between countries about what caregivers go through or what they need? Yeah,
I can say a couple things about that. We were just in Africa, spending time with our fellows in Ethiopia and also in Kenya, and went to one of the few care centers in all of Africa. In Kenya. It was run by an Irish originally nun, but it was, that kind of care was very rare in Africa. Mostly it's done within the family. So, and I'm not saying that's worse. In fact, I think a lot of times it's better.
Mhm.
But I think increasingly, our fellows are intensely interested in how to improve care, and how do you do this to a caregiver? And I'll just toot the horn of Bob Levinson, who we worked with at Berkeley, and Bob has done a series of studies that have shown that if a caregiver suffers from depression, the patient with dementia dies more quickly, and vice versa. Frontotemporal dementia, which puts a huge burden on caregivers, has increased mortality related to other dementias, just because of the enormous caregiver burden. So this is a huge issue, I think.
Somebody here has asked the question, any interest in the correlation between brain circulation, circle of Willis, developmentally, and brain function?
Yeah, I confess it's a new thought for me. The idea is, could possibly the circulatory system have an influence on early or later brain development? I think I can honestly say I bet there's not a single study on this, but I could be wrong. It's an interesting idea. I think there's no doubt as we get older and we clog up the circle of Willis that this has a very bad effect on cognition. But within the normal range, I don't know the answer to that.
And somebody here asks, are any studies being done in the United States? I assume they mean by your fellows or as part of the Global Institute. Oh,
absolutely. We have several studies where our fellows are working on with homeless in San Francisco. The first paper has come out. It showed that elderly homeless people have quite profound cognitive impairment. And so, I think these are important studies of justice, fairness, that I think will diminish homelessness if we understand it better. But there's a brain in homelessness that I think is badly ignored. Yeah.
Thank you. Any other questions out there? It's about time to wrap up, but we have time for one more if anybody has one. I guess we're going to wrap up. I cannot thank you enough, Dr. Miller, for being here and really expanding our world from what we're experiencing here in our country with respect to brain disease and helping us to see what the impact is globally and why we need to study this and work together globally. So I really, really appreciate it. And I want to just, before I say goodbye, thank you all once again for joining us tonight. We'd love to see you again. We have a great lineup of monthly webinars scheduled this year, including post-concussion tips and steps in preventing brain trauma on February 15th, and wearable technology for brain diseases on March 22nd, and more coming. So thank you very much. And as someone here says, thank you, Dr. Miller, for your wonderful and important work. Have a nice evening, everybody.
Thank you, everyone. What great questions tonight. Thank you, Jane.
Thank you. Bye.